going to be a little housekeeping in before we get going on the presentation itself. So thank you very much for joining us tonight. My name is Monique Ortiz. I'm with Iowa Child Care Resource and Referral. We also have Tammy Foley from the Iowa Department of Human Services on our panel tonight, as well as Jeremy Smith with the Iowa Navigator, who will be doing the presentation. Before we get started, I'd like to go over a few housekeeping items. First of all, to let you know, you might have been prompted when you logged in tonight to say that this session is being recorded. This is for informational purposes only, so we are recording that. So if you need to go back and listen to it, or for people that couldn't make it tonight, we're able to share that information out. It'll be available on the CCR&R website by the end of the week. So, so watch your email, and you should be able to see, you'll see an email come out with that link. Also, just an FYI, this isn't a meeting and not a training, so you will not be receiving DHS training credit for this tonight. So I just want to kind of let you know that as well. You do see, and there's a message in the chat box with the technical assistance email in there. If you're having any technical assistance at all during this meeting, you need a little support, just email me at ccrnr@midsu.org. And again, that's in the chat box if you need it written down there. And I will be sure to help you out with that tonight. So the other thing is, if you have any questions, instead of using the chat box, I would ask you to use the Q&A box. The Q&A is going to be for questions only. The chat box will be for any other interactions that we may be having. So the question box will just allow us to track the questions, and then we can also get the answers from Jeremy as we go through the presentation tonight. But first of all, we want to do a little poll. You're going to see a question come up on your screen. We're going to kind of find out who's here tonight, who our audience is. So I'm going to go ahead and launch that. Basically, the question is, we want to learn more about who is joining us tonight. Please choose the role that best describes you. Home-based child care business owner or assistant, child care center preschool staff person, a child care center preschool director or owner, other, a supporter of Iowa's child care system, so that could be anybody, CCR&R, DHS, so on and so forth, or none of the above. So just so we kind of have an idea who's here tonight. I see you've got that, you're seeing that. I'll give you a few seconds to get that done. Okay, it looks like we are just about there. So I'm going to go ahead and end the poll. And it looks like we have 25% of us are home-based child care businesses. 19% are center preschool staff. 42% are center preschool directors or owners, which is very good. Thank you for that. And 14% is the other, the DHS, the CCR&R, and all that. So thank you for that. So now we kind of have an idea who our audience is. That's really good to know. So I'm going to go ahead and stop that sharing, and I'm going to actually turn it over to Jeremy. And Jeremy is our presenter tonight, and he will be giving us information about the Iowa Navigator system and what his services are, what they provide, and how they can help you access the healthcare marketplace. While he's getting set up here, if you could also, at your earliest convenience, please sign in by entering your first and last name, as well as your city, town, your child care is located in. And thank you very much for that participation. So we'll go ahead and get started, and Jeremy, I'll turn it over to you.
All right, thanks. So yes, first off, thanks for having me. And I really appreciate everybody coming on and spending your evening learning a little bit more about healthcare. So I'm going to go ahead and share my screen with everybody. All right, so the goal for tonight, obviously having health insurance is extremely important. And most people out there, you're probably familiar with the option of being able to get insurance through an employer and offering group insurance. But what is a little bit lesser known is that there are options to be able to pick up health insurance through individual avenues. And so what we want to talk about tonight is more information on being able to obtain health care as an individual, and a little bit more about our free program that helps people guide, we just help guide everybody through this process. So I'll put up our contact information a couple times throughout the evening, but I wanted to get it on there quickly, just in case somebody can't stay the entire time. Once again, we're an absolutely free program just to help people figure out their healthcare options. So we do all that work over the phone, and we've got our phone number listed here. We've got our website, acanavigator.com. So just in case you want to go ahead and jot that down and you can't stay the entire time, we wanted to go ahead and throw that out there, and then we'll bring it up again at the end as well. So like I mentioned, the main goals for this evening, I want to talk to you a little bit more about what our program does and the kind of help that we can provide. Like I said, a lot of people, you may know about group insurance as an option, but we also want to make sure you understand more about your individual insurance options as well, because in some cases, or maybe a lot of cases, that may be a better alternative than going into the group market. So we'll talk about those options. We'll talk about the process for getting enrolled and seeing what's going to be best for you and your employees and your family. And then we'll go ahead and talk to you about how we can, get our information out there and the best way to connect with us. So first off, just a little bit more about our organization. So I work with a nonprofit organization called First Choice Services. And what we specialize in is we started and we run social service helplines. So we've been around for a little over 20 years now, but over the last several years, we've expanded pretty rapidly. I mean, we went from just a handful of employees a few years ago to we're working on almost 100 at this point. And so some of the programs that we do, we help answer addiction helplines, mental health helplines, tobacco quit lines, and then of course these health insurance enrollment helplines as well. And so we're a little bit unique in the fact that we're actually based in West Virginia. And so the way we got our start is the first couple programs we started operating was gambling addiction helplines. And so we've done that for West Virginia for years. And then a few years ago, we expanded into doing West Virginia's addiction and mental health helpline, the suicide prevention lifeline, tobacco quit line. We help answer 211 calls with the United Ways. And then we expanded and we also do work in Pennsylvania and Virginia. And then, of course, we've been doing this healthcare enrollment program in West Virginia for years. And about a little over 2 years ago, we noticed that no organization would apply to be what's called a health insurance navigator anymore in the states of Iowa, Montana, and New Hampshire. So based on our specialization in doing things over the phone, we wrote a grant to the federal government, to the Centers for Medicare and Medicaid Services. And we were selected to do that work in those, like I said, the other states as well, in Iowa, New Hampshire, and Montana. So for well over 2 years now, we have been the Navigator grantee for the state of Iowa, and we are the only organization that is statewide, that we help the entire state do that program. So like I said, I mean, the Navigator program, it's an absolutely free service to any Iowa resident. And what we do is, we don't operate off commission. We're not trying to push one thing or another. We're just an informational resource for people to be able to figure out what's going to be best for them and their family, and then actually assist with the enrollment. So we help people sign up for insurance plans on what's called the health insurance marketplace. And these are the plans that you can look at on healthcare.gov. We also assist with enrollments through the expanded Medicaid program in Iowa. And then, of course, the Children's Health Insurance Plan, more commonly referred to as CHIP. So we do that. We do those three programs year round. And so right now is the really important time to pay attention to the plans on the marketplace. And that's because we're right in the middle of the open enrollment period for the healthcare.gov marketplace plans. And that actually started November 1st, and it will run until January 15th. So that's a big reason why we wanted to do this webinar now, while, right in the middle of open enrollment, so we can make sure that people know that this is the time of year that you really have to pay attention. So like I mentioned, we've been doing this grant for a few years, and at this point we've been able to help, a lot of people across Iowa, but we still have a lot of capacity, and we actually just expanded the program. With this grant cycle that just started a few months ago, we was able to get a 3-year extension, and we was able to hire a lot more navigators for our program so that we have more capacity to help more people. So we really want to try to get the word out and make sure that people know that if they have questions, this is the place to go. And that way you don't have to get sucked down that internet rabbit hole of doing Google searches and trying to figure out what's real and what's not. You can actually talk to a live person, and we'll help, walk you through all of this. So if you're not familiar, the health insurance marketplace was created under the Affordable Care Act that was, signed into law in 2010. It was launched in the fall of 2013. And so the whole idea behind it is that if you can't get insurance through your job or Medicare or Medicaid or the VA, if you're a veteran, then you can shop for private insurance plans on the health insurance marketplace, and the government will generally help pay for the plan that you picked. So that's in the form of what's called the advanced premium tax credit. And so what that is it's a monthly subsidy that the government will give you to help you pay on whichever plan that you picked. And in most cases, the amount of subsidy they will give you each month covers the bulk of the cost of the insurance plan per month. So that's what a lot of people don't really realize, is how that advanced premium tax credit works. And that's a big part of what we do, to explain all that to you and help you get that advanced premium tax credit to help pay for your insurance plan. Another big part of the plans on the insurance marketplace is that if you have a certain income range, a lot of people can qualify for what's called cost sharing reductions. And so what that does is that lowers the cost of your deductible and co-pays right away. So just for example, what normally might be a $4,000 deductible that you have to hit, if you're in a certain income range, you automatically can qualify for, a deductible that's maybe 1/4 of the original cost. So that 4,000 deductible goes down to 1,000. And that's just an example. It just depends on what your income is. But generally, that's how the cost sharing reductions work. And then, of course, the other programs that we help with, like I said, is the expanded Medicaid program and the CHIP program. And a lot of people don't realize, but expanded Medicaid has just been a huge boost to be able to get people health insurance, and a lot of people qualify that you may not even realize it. So let's talk just a little bit more about the plans that's offered on the health insurance marketplace. So we have gold plans, silver plans, and bronze plans that are on the marketplace. So a gold plan, that's generally something like an 80-20 plan. And you may be familiar with that term if you've ever had employer-based insurance. That's generally how a lot of employers describe their plans. But then, the silver plans that are offered are 70-30. The bronze plans are 60-40. And generally the bronze plans are little to no cost per month, but the deductibles might be higher. And then as you get into your gold plans, the price might be higher per month, but your yearly deductible is much lower. So those are the kinds of plans that are offered on the marketplace. So the plans that are offered on healthcare.gov on the marketplace, they have to be, the company that's offering the plan they have to go through a process. So not just any willy-nilly company can throw a plan on the marketplace and try to sell it. They actually have to be licensed by the state of Iowa and in good standing. The Iowa Insurance Department looks at all the companies that sell plans, and they make sure they're in good standing, and they review the plans before that you ever get to look at them, just to weed out and make sure that only legitimate good companies are selling plans. All of the plans on the marketplace, they also have to cover essential health benefits. So any plan that you look at on the marketplace, all of them have to cover at least some things. And then, of course, each issuer has to offer a variety of plans. They have to offer at least a silver and a gold. And then they have to offer the plan at the same price as they would even if it was off the marketplace. They can't change the pricing around whether it's on healthcare.gov or not. So I mentioned just a second ago the essential health benefits that the plans have to cover. So this was one of the things that the Affordable Care Act did. It used to be before the Affordable Care Act was passed, and if you're shopping for private insurance out there, the insurance company could pick and choose what kind of coverage they offered you. And a lot of time the devil was in the details. So you get a plan and then you find out, hey, it actually didn't cover prescriptions, or it doesn't cover hospitalizations. The Affordable Care Act changed that, and so all of the plans offered now, they have to cover these 10 things that's listed here. So, things like hospitalization, mental health and addiction treatment, preventative services, prescriptions. All plans have to cover at least those things at a minimum. That way there's no surprises on the back end where you've signed up for something and then it turns out, surprise, it doesn't actually cover that service. So that's a good thing to kind of take that worry away and make sure that any plan that you're signing up for, it at least has to cover these things. Another big part of the plans that's offered on the marketplace is that they all have to cover what's called preventative care benefits. And so these change a little bit from year to year, but in a nutshell, the way it works is if you have the insurance, you can take advantage of free preventative care just because you already have that insurance. So, things like blood pressure screenings and cholesterol screenings for certain adults, colorectal cancer screenings, depression screenings, diabetes screenings, yearly exams for women. There's a lot of different options that you can take advantage of just because you have the insurance. And each company, they have a list that they can provide you with all the preventative care services each year. So who's eligible to be able to get a marketplace plan? First off, like I mentioned, generally, if you're going to be up shopping for insurance on the marketplace, this is designed for somebody that's not offered insurance through a job or can get insurance through another avenue. In addition to that, you have to live within the United States. You have to be a U.S. citizen or lawfully present and not be incarcerated. And then, in any other circumstance, you should be okay to go ahead and shop for insurance on the marketplace. So I'll mention this. I don't want to get too confusing, but it does come up pretty often. One of the things that we run into with eligibility when you're shopping on the marketplace, like I mentioned, if your job offers you insurance, 95% of the time, that's generally what you have to take. The only exception to that is if it is deemed unaffordable or the insurance your employer is offering to you doesn't meet those minimal ACA requirements. But what we run into a lot of time is also if you're married and your spouse's job offers you insurance, generally that creates a situation to where you can't go on the marketplace only because you're offered insurance through your spouse's employer. And we call that the family glitch, because what happens is a lot of times your spouse's company they may offer you insurance, but it's really expensive. Unfortunately, a lot of the time, if they offer it, a lot of times you're stuck either having to take that, or, if you try to shop on the marketplace, you can't get those subsidies I was talking about earlier. So it gets a little bit confusing. So if anybody has further questions about that, that's something that we can help with, to see if you do qualify for marketplace, or if you have to take your spouse's company insurance. So I did just want to throw it out there, though, just because we do run into it a lot. So once again, the linchpin of the whole program for insurance on the marketplace, it is the advanced premium tax credit. And so, like I said, if you can't get insurance through another avenue, then the vast majority of people, I mean, I'm talking about, 9 in 10 people, they qualify for these monthly subsidies that helps pay for the insurance plan that they've picked. And the amount that they can get per month is based on your yearly income, your household size, and then, of course, your geographic area that you live in. So the amount, like I said, the amount that you get is based on the income, and it's all going to be based on your 2022 projected income. And I know that gets difficult for people sometimes, because you don't exactly know what you're going to make. But that's something that we try to help people with. If you have a copy of last year's tax return, or if you have current pay stubs, we'll try to sit down with you and help you come up with a good solid estimate for next year. Because everything is going to be based on that estimated income for next year when we're looking at the prices of what you'll end up paying for the insurance plan. The cost sharing, like I mentioned earlier, what that does is, if you're of a certain income bracket, that lowers the cost of your deductibles and co-pays. And so what that is if you're 250% or below of the federal poverty level, then you can qualify for those cost sharing reductions. And it really makes a huge difference. I mean, we're talking about a deductible that could be thousands. All of a sudden it becomes maybe just a few $100s. So folks that qualify for those cost sharing reductions tend to just absolutely love this insurance policy, because those deductibles are low. Their monthly cost is very low, or they have no monthly cost. So definitely, if you're in that 250% income bracket, these tend to be extremely good plans for folks. So like I mentioned earlier, this is definitely the time to pay attention to insurance options, because if you're having to either make a decision on whether to offer group or look at the individual options, now's the time that we have to look at the individual insurance options through the marketplace. As I mentioned earlier, the open enrollment period for 2022 is going to run from November 1st to January 15th. And in most cases, if you miss that enrollment deadline of January 15th, you may not be able to get coverage again until 2023. So really, this is definitely the time to look at the options. I will mention the exception to that is, if you lose your current insurance policy in the middle of the year, that creates what's called a special enrollment period. And so anytime that you have a current insurance plan and you lose it, that creates that special enrollment period. And you actually have 60 days from the time that you lose insurance to be able to go ahead and pick up a marketplace plan. The other thing to think about when we're talking about, enrollment timelines is, if you think you might be eligible for the expanded Medicaid program or CHIP, you can actually enroll in those programs year round. And so those are, if you're at 138% or below of the federal poverty level, if you're between the ages of 18 and 64, and you're below it and you're in that income bracket, then you can pick up expanded Medicaid in the state of Iowa. So this has been absolutely huge when it comes to individual insurance on the marketplace. And I keep going around and telling everybody this year, the marketplace has been around for 9 open enrollment periods now. So a lot of people may have heard about it. And at some point over the last 9 years, you may have went on healthcare.gov and looked at your insurance options. And a lot of people, they come back and they tell me, no, I wasn't real impressed with the pricing. I passed. I don't want to take it. But the American Rescue Plan that was passed earlier this year in April, it was a real game changer when it comes to insurance on the marketplace. And so this is, you may be familiar with the American Rescue Plan because this is the law that was passed that provided the stimulus checks to a lot of us. But the other thing that it did kind of behind the scenes that a lot of people didn't realize is it made all of the insurance plans on healthcare.gov more affordable. And so what that did is it increased the amount of subsidies that everybody can qualify for. And so I have seen the best pricing that I have ever seen when it comes to looking for insurance on the marketplace. So I keep trying to tell people, even if you've looked at insurance before on the marketplace, you really need to come back again this year and look, because I'm seeing the best deals that I've ever seen with these subsidies that people qualify for. A huge percentage of people can qualify for a plan for under $10 a month. So it's been really great to watch these lower prices come out and, see what people can qualify for. The other big change, and this is something we're trying to get the word out about as well, is even higher income earners can qualify for subsidies now. And I say higher income earners, it used to be the cap to be able to qualify for the subsidies. It ended at 400% of the federal poverty level. So just for example, a family of 2, that was somewhere right around like $68,000 a year. And if you made even a penny over that limit, you could get no help on your insurance. But now they've removed that cap. And so I'll give you an example. I helped an attorney sign up for her insurance just last week, and she was paying something like $1,800 a month for her insurance policy last year. And this year, all of a sudden, she qualified for $1,000 a month subsidy. And she was just ecstatic, and she had no idea that she would qualify. And she makes about $120,000 a year. So, that was a great example. Even though she makes $120,000 a year, she could still get a subsidy that helps pay for her health insurance. So, moral of the story is, even if you've checked into healthcare.gov in past years, please come back and look at it again, because the prices really are a lot better than we've ever seen. And even, even people that didn't qualify before, they can qualify now. All that being said, the American Rescue Plan, it is somewhat temporary for the lower prices. It right now it's guaranteed through 2022, but unless Congress does something to renew it or pass a new bill that will extend the subsidies, the pricing might go backward a little bit starting in 2023. It could go back to some of the old rates and some of the old rules. But for now, for 2022, this is a great option, and then we'll see what happens in the future. So we have 3 different companies that offer plans on the insurance marketplace in Iowa. We have Medica, Wellmark, and Oscar. And so all 3 companies, they've been around for a long time. A lot of them do business in various different states. So all of them offer a variety of different plans to pick from. And, it's one of our jobs to make sure that we're, answering all of your questions and helping you figure out which company might be best for you and your family. So the other program, like I mentioned, that we really spend a lot of time with is helping people sign up for the expanded Medicaid program. I mentioned earlier that, you can make up to 138% of the federal poverty level. So Here's just a quick chart that kind of gives you an idea of what that looks like. If your income is under, this bracket, this is something you really should check into, because you're likely to qualify for the expanded Medicaid, and it's really good coverage, and a lot of people super happy when they can qualify for that. So if you know somebody that's making within that income level, that's something we can help with. You just give us a call and we can help do the application right over the phone for you. The other part of our program as Iowa Navigator is we're here year round. Even though the open enrollment is our really busy season, we're here all year long. Anytime that you have issues figuring out a bill, or using your health care, or finding a primary care doctor, or you get an EOB statement and it breaks down what the insurance paid and what it didn't pay, and you're having a hard time figuring that out, that's something that we help with year round. I often describe an insurance navigator as sort of a cross between an insurance agent and a social worker. We're here to answer all of your questions about insurance. There is no stupid question. We're just here as a resource for you and your family. And so we try to build that relationship with you throughout the year. That way, anytime you need help with something healthcare and health insurance related, we're here to be able to answer those questions and assist you in the process. So if you are interested in learning more about what you might qualify for and trying to get some price quotes for you or your staff, best thing to do is give us a call. We are in normally our normal business hours, Monday through Friday, 9 a.m. to 5 p.m. every day. But after this webinar, we were hoping a lot of people would be interested in learning more. So we are doing some specialized hours this week. So we're actually going to be open late this coming Thursday. We'll be available until 8 p.m. And so if you work throughout the day and you're real busy, but you've got a little bit of time in the evening, we'll be doing the expanded hours Thursday evening. And then, of course, we'll also be coming back and doing expanded hours this coming Saturday. So we'll also be available from 9 a.m. to 2 p.m. on Saturday. If you're really busy through the week and you still want to try to work with us, give us a call. Like I said, this Thursday evening and this Saturday, you can give us a call and we'll be standing by. We're doing that just special just for the folks on this webinar, just because we know that you're pretty busy through the day. So some of the things that you're going to want to get together before you call. Generally, if you're actually, if you want to sign up and you're doing the enrollment, you're going to need dates of births and social security numbers for yourself and everybody in your household. You're going to need that projected yearly income for 2022. And then the other thing that's going to be helpful is a list of your doctors, hospital facilities that you use, and then also a list of your prescriptions. And that way we can look at the 3 companies that offer the plans and make sure your doctors are in network, make sure your medicines are going to be covered, and just help you figure out which company and which plan might be the best fit for you. So if you have that information together, it definitely makes it a little bit easier. If you're going to call on behalf of your staff, what we need is their zip code, the ages of the person that we're trying to look at the insurance for, their spouse's age, their dependent's age, and then their yearly estimated income, and then their tobacco status, if they use tobacco or not. And that allows us to help you be able to get a price quote. So just to summarize some things that you'll want to consider when you're trying to get yourself and your staff covered with insurance. Obviously, group insurance is an option, and we always recommend working with a reputable insurance agent in your community if you're looking at the group insurance option. And then, of course, your alternatives are the marketplace insurance, the expanded Medicaid program, and then the CHIP program for kids. So like I said, we have a lot more capacity this year with our new grant that was handed down. So we have a lot of promotional items in our office. We've got business cards. We've got a whole lot of flyers. So if you would like to reach out to us, we can talk to you about your location. We would love to mail you some flyers and brochures and business cards to hand out to anybody that you work with or any parents that you might work with. We're really trying to get the word out about this program. And then if you're interested in maybe even trying to set up a specialized event, we could maybe do something over Zoom with you or your staff, or special hours if you'd like us to maybe try to do an evening or a weekend if your staff has to do that. So just talk to us. We'll work with you. Our whole goal is to just get everybody insured and get the best plan for them and their family. So once again, our contact information, acanavigator.com, or you give us a call locally, 515-978-9570. And, just talk to us and we'll answer all of your questions and do our best to help you and your staff or your family figure out what might be best for them. So if anybody wants to work with us, please reach out. That is all I have presentation wise. I think we still have some time, so we can try to go ahead and start looking at some questions if anybody has that.
There is one question in the question box. Do we have to pay the government back for the Medicaid program at some point?
Generally, no. Really, the only time that you may run into that, it's the same rules that Medicare uses. And that is generally if you are on Medicaid and you end up in a long-term nursing home facility. In some cases, if you're the last surviving member of your family and you've been on Medicaid and you've been in a nursing home or a situation like that, at some point the state can make a claim against your property and try to come back and get your home if you're in that nursing home situation. It's this, like I said, it's the same rules that Medicare uses. But other than that, no. The expanded Medicaid program, it was created just to provide insurance as long as you're within that certain income bracket. So it's not something you'd have to pay back if you're on Medicaid. I would like to take this opportunity, though, to mention that while we're on that topic, if you get marketplace insurance and you're getting that monthly subsidy I was talking about, like I said, everything's based on your 2022 income. But let's say your projection is way off and you make way more money than you thought you was going to. In some cases, you may have to pay back that subsidy when you file your 2022 taxes. And the amount you have to pay back it depends on how much you went over your projected income. I hope that makes sense.
Thank you for that. I do have a question. It's not in the question box, but could you talk us through the process of when they call in just a little bit more and give us a little more details about what that would look like? Yeah,
absolutely. So like I said, we're in Monday through Friday, normal business hours. And when you call, we just answer the phone and we start talking to you about what kind of help that you're looking for. And so if you tell us that you're looking for health insurance, we really just try to do a little bit of screening to make sure that you're going to qualify for something we can help with. So we might start talking to you about if you're offered insurance through a job, or if your spouse is offered through a job, or if you have current coverage. And then the other thing, like I said, is we try to help you figure out your 2022 projected income. And then that tells us what you're going to qualify for. So that's going to take us in the direction of seeing if you're going to qualify for Medicaid or the health insurance marketplace. And generally, as long as you have at least 10-15 minutes to talk to us originally, we'll go ahead and start giving you some price quotes. And that way you know if it's even worth your time or not. So we'll actually help you figure out your 2022 income, and then start talking to you about the different plan options and how much they're going to cost you. And so after that original conversation where we screen you for income and then we talk to you about the price quotes, if you're interested in enrolling at that point, we generally make an appointment with you, and then we call you back at a later date. And the whole process to enroll, it generally takes about 45 minutes to an hour. And so we block off that amount of time to make sure that we get you through the application to be able to get you those subsidies and help you get signed up for the plan you want. And then you're generally good to go for the year.
All right, perfect. Thank you for that. Somebody was requesting if you could put the phone number up again, what that is, or let me know, and I could put it in the chat box as well.
Yeah, actually, let me just throw it back up here on the screen real quick, and we'll just leave it up. Can everybody see that okay?
Yeah, perfect. Thank you. Yes, that would be wonderful. Thank you very much. And then another question, several came through with that conversation. So what if your income ends up being lower than what was projected?
It's a good question. So if you end up being lower than what you projected, you're actually going to get a larger refund on your taxes when you file, because that means that you was paying too much for your insurance and you didn't get enough of a subsidy. So at that point, when you file your 2022 taxes, you end up just getting a larger refund to get those subsidies back, because you didn't make what you thought you was going to.
All right. Thank you. The next one is from April. Is this just for medical, or does it include dental and vision?
Some of the plans do have the option of bundling dental and vision as well. Other than that, as far as like for somebody that's just looking for like a standalone dental or vision, it's generally not a good fit. It's not an option. But if you're looking for medical that has some dental and vision coverage, some of the plans do have the option to bundle that in with it.
Wonderful. And then Bonnie asked, what is COBRA?
Yeah, so good question. COBRA, it's been around for a long time. Some people might be familiar with it. COBRA is offered to you when you lose a job. So if you have had insurance through your employer, you can actually keep that same insurance plan that you were already on. But what happens is the employer won't help pay for it anymore. So at that point, you're going to have to take on the whole cost of whatever the insurance policy had cost, what your portion was, plus what the employer was helped to paying. And so at that point, you can generally stay on COBRA for, at least a year, and longer in some cases. But the price tends to be really high. In a lot of cases, I mean, we're looking at, $600 to $1,800 a month. But in some cases, it might be a good fit. That's something that we can talk to you about if you're interested in trying to figure out if COBRA is going to be a good option for you versus the marketplace. But, once again, it's generally what happens is you get that offer of COBRA whenever you leave an employer, or you're let go or something like that. You have that option to keep the insurance plan that you were already on. You just have to continue to pay the full price.
All right, thank you very much for that. And then I have first, thank you for taking the time to share with us. Do you assist organizations or nonprofits finding affordable group insurance for staff, or do you only offer it on an individual basis? Thanks for any information you may have.
So everything is individual, but what we've done in the past is we've worked with an organization and we'll go in and talk to each staff member. And so what some employers have done in the past is they'll have each staff member come to us and get a quote for how much the insurance would be. And then they take it back to their boss and they share how much it would be. And then that helps their boss figure out, well, would it be cheaper for everybody to just go get their own insurance, or would a group insurance option be better? So yeah, in short, everything we do is on a per family basis. If you're looking at wanting to go the group route, I recommend working with a good insurance agent in your community to look at group insurance.
Yeah, and this is Tammy, and I was actually on a webinar today with some national organization that's been trying to get the word out for that really is highly vested in the childcare industry, and really pushing for this other option with the marketplace as being a much more affordable option for childcare, and to be able to have that for individuals working in childcare or staff in a center, compared to like the group policies that sometimes are just way too expensive for the wages and for individuals working in childcare.
Thank you for that, Tammy. Well, I'm not seeing any other questions at the moment. So if you have any, either put them in the chat box or the question and answer box, and we'll get those answered for you. As we're waiting for that, Jeremy, could you once again talk about the hours that you're going to be available? I know we're doing some extended hours just for this situation this week. So if you kind of let me know one more time what those are, and we'll get those typed in so that people have those hours, that'd be great.
Yeah, absolutely. So we kind of had the idea that a lot of people in this particular webinar, you're probably busy through the day, and maybe evening time is going to be your best option, or on a weekend. So we've asked our staff to be able to stay and put in some extra hours to be able to help people that may want to call. And we're going to be open this coming Thursday, so I think that's November 18th. We're going to be open until 8 p.m. And then on Saturday, we'll be in from 9 to 2. So this coming Thursday evening, and then Saturday until 2 p.m. Will be available. And really, we just wanted to do these extra hours just for the folks on this webinar. That being said, if you know somebody, share the information. If for some reason we're all tied up on the phone and you called during those hours, just leave us a voicemail. It generally takes us 15, 20 minutes tops to get the message and give you a call back. But, once again, this Thursday evening or this Saturday, give us a call and we'll talk to you about your situation and see what we can do. Also, like I said, if you want to set up a private meeting for us to talk, give us a call and we can try to do that. And then, like I said, we can also mail you out brochures, flyers, business cards, all that kind of stuff. If there's any way you can help to promote this to your families or your staff, or anybody that you think might want the information.
All right, thank you very much for that. And I'm putting that in the chat box right now, so you have that information as well. There we go. So you have it in writing there. So appreciate that. Does anybody else have any other questions? Looks like don't have anything else come up. So it's Jeremy or Tammy, unless you had anything more to add, I think we'll probably go and end the conversation.
So Monique, if we could take the opportunity for those that are participants that are still on in the chat, can you put kind of one takeaway that you got from tonight's webinar, that you learned something new, and share that in the chat. Also, you are also our best connections, as Jeremy mentioned, to families that you provide care for their children, and then also other providers, childcare providers and businesses within your community. So please feel free to share this information as the webinar recording does come out. With the link for those that were not able to attend. Please be sure to pass that along through your networks, because I know a lot of you might have Facebook groups and other organizations and things that you connect to. So within childcare and in your community, to share that. And
thanks, Tammy. And we do have a couple of comments. Actually, Tricia, how to search for health insurance without being your phone being blown up for just searching for insurance. This came in a perfect time for me, so that's great to hear. And then ARPA funds may lower the cost of premiums. Another comment. And Carrie said this will definitely make a confusing program simple and less scary. So I have to agree with that. Liz, I use this insurance and at first it was confusing. Nice to have help for staff. And Beth says the money saving that was passed this year was very interesting and helpful. So just some comments there. Well, thank you everyone for sharing those.
I wanted to mention too, Trisha left a comment here about her phone being blown up. That is just a caution that I'll put out there. If you do a Google search for insurance, it's hard to tell what you'll come across sometimes. Some of the websites, they're very predatory and they'll put you on a telemarketing list and they will just bother you nonstop every day. And a lot of what they're trying to call and sell you isn't legitimate marketplace insurance. A lot of times it's what's called a short-term limited benefit plan. And the folks on the phone, they're telemarketers. They're not going to tell you that. This is a situation where sometimes a Google search does more harm than good. So just be very, be very careful where you're shopping for your insurance. And if you have questions about the legitimacy of something you're looking at, that's something that you can call us about as well.
Thank you for that reminder, Jeremy. And Liz just went on to say as well, to add to her previous conference comment about how she uses this insurance. But just to remember that if staff has spousal insurance, they probably won't qualify. So we're just a reminder there. And I have tried in the past to get insurance, but it has been a nightmare to find insurance. So I'm glad to have this option to join this and be able to proceed in getting insurance. Great, April. So good to hear that. Glad this will be helpful for you. Okay, and if there isn't anything else, we'll go ahead and end for tonight. But I did put the comment in the chat box about where the recording will be. It will be on iowacCR&R.org. Like I said, give us a couple of days to get that up and going, or check in with your local CCR&R and we'll get you there as well too. So thank you very much for joining us tonight and have a good rest of the evening. And thank you, Tammy and Jeremy, for your time as well.
Great. Thanks everybody for taking time to join us.
Thanks, everyone.
All right, well, good. Looks like we had pretty good turnout and that was very successful. So thank you for that. It sounds like some people are very interested. So if we reach at least one, we've done our job, right?
Yeah, absolutely.
So that's anyway. So, well, thank you very much, Jeremy. I'm sure we'll be in touch with you moving forward on how this looks and where we're at with it. And, maybe we'll need to do a second round, once Medicare does its thing. So definitely keep that in mind. We'll be open to doing that if we need to have that conversation. I'll let Tammy know and we'll get that scheduled too. So,
okay.
All right.
Sounds good.
Well, thanks so much. We'll talk to you soon.
Thank you.
All right. Have a good night.
See y'all. Bye.